Hi, Dr. Sheldon at DC Wellness Chiropractic Center. You've known me now since April of 2013. This is now January 29th. We are 3 years since January 17th, 3 years since my SI joint screw fixation without fusion. And you've been working with me through all my other lower extremity surgeries till this date. And now on this date, I'm actually 6 weeks since my very last lower extremity surgery, which was my right ankle arthroscopic and the reduction of my hypercular stent in my foot. So now, in just the last few weeks, I've really been putting the package together, and I've been walking, practice my walking, and I'm working with a physical therapist to get my feet, all the muscles and the tendons in my feet, moving properly. And so it's been a really good day, and then I've been, translating this up my spine, and so I've come to you, Dr. Sheldon. You've been keeping track of my spine all these years, and it's now time for you to say objectively what you see and how I progressed in all these last 3 years. Go ahead, Dr. Sheldon.
I mean, you've put a lot of work in on your end. So, I mean, the chiropractic piece of the puzzle with you, but a lot of it is also what you're doing to help better yourself. People who take an active part in their care just do better. And so, at some point we'll do another X-ray, and that'll really, tell us even more. But you can just tell on the range of motion and palpation and things like that how much better you're doing. Your paraspinals are even. We don't see that muscle guarding and that body wanting to protect the joint like it was when you initially came in. And I mean, even from that very initial X-ray to our second X-ray, the side views on your cervical and lumbar curves were more what we like to see. And you hold adjustments better when you come in. The type of adjustments we get now are so much more on a minimal level. You're to that true wellness maintenance type of place we like people to be, versus trying to go through the stabilization, the more the crisis care. It's not that you haven't had other issues either. I mean, you've had the whole knee, knee off the hay bale.
Oh yeah,
and that's one of the things that's always a good testimony of where you're at is life happens, injuries happen, whether it's repetitive injury or the big injury like that type of thing. And so for your body to be able to handle that, and maybe a minor setback, but we see you get through it, and the wheels don't totally fall off, and we get you back. So yeah, you're doing great. And just now you're to that point where you do take an active part in your care, and you just hold adjustments better because of that too. So.
Well, I'm very grateful. Would you say that in 3 years' time of working with me, would you say it's been a very positive experience for me to have these screws in my SI, even though it's not your expertise, you're not a surgeon, you don't follow up cases like that, but would you say that, it certainly hasn't hurt me, and it hasn't, obviously brought me the ability to find myself in many other ways?
Well, and you have great range of motion with it, and, I never saw you before any of that, so I don't even have a base level where you were before, but I mean, man, where you're at now, you're doing awesome.